12 key cities all over the country: Mumbai, Delhi, Chennai, Bangalore, Hyderabad, Ahmedabad and Kolkata. To enlighten us more on this, I request our Group Medical Director and Senior Consultant, Pediatric Gastroenterologist and Hematologist, Apollo Hospitals, Dr. Anupam Sibal, to please say a few words.
Good afternoon, our special guests, Sohaji, Arunesh, Ravi, Kiran, Dr. Shivaja, Professor Dhavnendra Kumar, who is joining us from England, our friends from the media. Very good afternoon to all of you. What I'm going to be doing is really look at how genomics is going to progress in the next few years. So all of us are very familiar with Nostradamus and his prophecies. He predicted the Great Fire in England, in London, the rise of Napoleon, the rise of Hitler, the Second World War, assassination of Mr. Kennedy, 9/11, the nuclear disaster in Chernobyl. But what about his predictions as we speak? Let's look at 2025. Like the sun, the head will seal the shining sea, the live fish of Black Sea will almost boil. So what was Nostradamus referring to? Was he talking about earthquakes? Was he talking about global warming? Was he talking about climate change? The new sage with a lone great Caesar by his disciples invited to be immortal eyes to the south. Now is he alluding to AI and all the variations of AI that we are now becoming familiar with? Is he referring to robotics? Is he referring to ML? So just like we have Nostradamus, we also have predictions in genomics, and these predictions came from Dr. Francis Collins, and he gave predictions for 2010, for 2020, for 2030 and for 2040. So let's see how those predictions have panned out. So in 2010, he talked about gene variants will become known for common diseases. There will be lots of debates. There will be interest in pre-implantation and legislation. So there were 9 predictions, of which 4 were correct. 2020, a total of 7 predictions of 4 came out to be true. That there will be gene-based designer drugs. Cancer therapy will be targeted based on genomics, and there will be lots of databases, and there could be more accurate and faster diagnosis because of genetics. For 2030, let's see what happens in the next 5 years, but the prediction is all 4 will turn out to be true. That aging genes will be catalogued, there will be trials to extend human lifespan, there will be lots of models that we will be able to work with. We will have sequencing that will cost less than $1,000, and of course there will be a fair amount of debate on whether this should or should not be used. And 2040, of the 7, at least 5 are going to be correct, which is really comprehensive genomics-based healthcare, disease predisposition based on genomics, newborn testing, gene therapies, and of course there might be some conflict because of that. So as we speak, more than 30 different types of cancer is now determined by gene therapy in terms of the genomics guiding therapy. So all of us are very familiar with breast cancer, but this is also true for lung cancer, it's true for ovarian cancer, it's true for colonic cancer. There are more than 250 drugs where our genetic makeup helps us decide on whether that drug is going to work or not work. Common drugs like statins and amitriptyline, azothioprine, which is an immune suppressant, clearly a genetic basis. And we are able to diagnose more and more conditions because of progress in genomics, conditions that were not clearly diagnosable because we weren't sure where they fit in, can now clearly fit into a particular category, and very importantly we can prognosticate like what is the future, what's going to happen to that person based on the gene that that individual has or that tumor has, for example. So when cell phones started in India, I mean there are a lot of people who are very young and won't perhaps remember that it used to cost like up to 24 rupees to make a call, and you have to pay even to receive a call. And now it's 6 paisa per minute. Now the same is happening with genomics, and we are now moving into the social genome era. What is happening is that the cost is coming down, and because the cost is coming down, accessibility is increasing. $3 million was spent on the initial project for the human genome, and now the whole genome sequencing as of this year costs 60,000 rupees, and the exome sequencing, where you look at targeted genes, that costs about 18,000, and we get this result in about 2.5 weeks. But going forward, we believe that the cost of this will come down to less than 10,000 rupees. This 2.5 weeks will become a few days. We will start using these tests more and more, and they will become integrated into clinical practice, which has started to happen. And perhaps a time will come where we will sequence every newborn to be able to predict how are we going to manage them. Gene therapy, there's a lot of interest. There are more than 20 diseases where we're looking at gene therapy, and there are different ways that it's being studied. The first patient in the world was treated with this CRISPR gene editing therapy for a very rare condition where the baby was not able to handle urea which is produced in the body, and this child would have required a liver transplant, but because of this therapy did not need a liver transplant. And I'm just going to give you 4 or 5 examples on clinical cases. So these are some of the patients that we've treated. A 9-month-old boy with fever and diarrhea and vomiting develops liver failure. It's very unclear what the diagnosis is, but we figure out through genetics that he has hereditary fructose intolerance, so he needs to avoid fructose, which means he cannot have any fruit because his body cannot metabolize fructose, which is present in fruit. A child presents with diarrhea with mucus and blood, is thought to have a cow's milk protein allergy, a condition which we are increasingly seeing, which we did not see till 5 or 7 years ago. But that was really not the case. The child didn't get better on a diet, so we did a test, and the child was found to have a gene which gave us the diagnosis of inflammatory bowel disease, which is a lifelong condition, unlike cow's milk protein allergy. Another child with blood and diarrhea, again thought to have a cow's milk protein allergy, turns out to have a very rare disease which would have predisposed this child to repeated infections. The only treatment for this child was a bone marrow transplant, which this child underwent. A 5-year-old girl develops liver failure, thought it wasn't very clear what exactly she had, and she was found to have one of the rarest of rare conditions, a bile acid synthesis defect, needed a liver transplant, without which she would not have survived. An 11-year-old girl, again with liver problems, was thought to have autoimmune liver problem, but actually had a very rare condition. So all these conditions, once you have a precise diagnosis, then you can offer specific treatment. So we decided to embark on establishing genomics institutes across the country. We started off with Delhi, and now we have 12 centers, and we're going to be adding to more cities as in this year and the next. We are focusing on preventive genomics, which is really what is it that we can do for a particular disease not to develop in an individual. We're looking at specialty genomics in endocrine, in cardiac, in neuro, in kidney disorders. Reproductive genomics, very important in terms of preventing a disease from developing if there's family history in the newborn. Lots of work in pediatrics, and then of course cancer genetics, which has really received a lot of attention of late. So we have centers pan-India, and each of the centers is built on 3 pillars: clinical work, academics, and research. So we do a lot of academic activities. We have monthly case-based discussions, a lot of continuing medical education programs. We review latest research and engage with clinicians in each of the cities and beyond where we have a presence. So we were privileged to have Ms. Shamila Tagore launch the center in Mumbai, and there you can see her, and it's fitting that today we have her talented daughter come for this function. So thank you so much, Suhaji, for finding time for us. Then we launched our center in Tamil Nadu, in Chennai, where the governor launched it, and then we had a launch in Hyderabad and so on. See, standardization works really well, but sometimes standardization has issues, right? So what we really need is personalization, because each one of us, the 8 billion people that we have on this planet, have a unique genetic makeup, and because of that, we behave differently, we age differently, we respond to medication differently, we get different diseases. Now, who would want a nice suit like James Bond, right? But then one size doesn't fit all, and this is what happens when you go on and do online shopping. Tom Cruise has acted in more than 50 films. He's been acting for 45 years. The first Mission Impossible film came out in '96, and there have been 8 of these. And this is Tom Cruise, 20 years old, 1986, first Top Gun, and then when the second one came in, you can see he looks pretty much the same. So what is so special about Tom Cruise? Because it really doesn't apply to other people. Now look at Johnny Depp, 1990s, 20 years old, look at him. This is what happens to most of us, right? So what's special about Tom Cruise? So friends, it's all in the genes, and it's about time we started focusing in the right direction. Thank you so much.